Good morning, everyone, and welcome to Health Talk. I'm Peter Christian. Joining us right over there is John King. Good morning, John.
Good morning, Peter.
And special guest in the studio, Dr. Michael Woods from a Community Medical Center and Bone and Joint. How are you, sir?
I'm doing great.
All right. So tell us a little bit about Dr. Woods. Now, you're an orthopedic surgeon.
I am.
So how long have you been in Missoula, and how did you get involved in this work?
So I've been a orthopedic surgeon for over 30 years, and I've practiced in Colorado and New Mexico, where I grew up, and then I moved to Missoula in early 2002.
What brought you here?
Fly fishing,
Aha!
the grizzlies,
Okay, not necessarily in that order, right?
not necessarily,
Okay.
and it was a great medical community here. So we looked around at several places and just fell in love with Missoula. We actually came on homecoming weekend, 2001.
Wow.
And I knew Joe Glenn from Colorado, and so I got a couple of tickets to the game.
Well, there you go.
We did a tailgate. We fell in love with the place.
I still have my championship ring from 2001.
That's great.
Believe
And
it or not.
I love hearing you in the stands.
Well, it's a lot of fun. I can't imagine not doing it. Let's put it that way. But luckily, I have a healthy back. So when we're up there, everybody's standing. There's nobody sitting at all. And so, but you have a bad back. I understand it's really hard to stand all day, right?
It is, absolutely.
So tell us the reason. The reason why you're here is we're going to talk about the sacroiliac joint. And everybody hears, I'm a sacroiliac. Well, we don't really understand what it is. So if you could just kind of tell us what that's all about.
Okay. So the sacroiliac joint, we just usually call it the SI joint because it's easier to say and easier to spell.
Okay. Even I could spell that.
That's right.
Okay.
So it's two joints at the bottom of your spine, and they're mostly connection joints as opposed to motion joints. There is a little bit of motion, but not very much. But they're huge connection joints that essentially attach your lower spine and your upper body to your pelvis and your lower body. So they're these really very big, strong, powerful connection joints. But they do move enough that they can be painful, and they're subject to arthritis and breakdown and inflammatory conditions, just like any other joint in your body.
Mm-hmm. So what is the main reason why people come to you as an orthopedic surgeon in this particular area?
Well, I take care of a lot of patients, and my area of specialty is mostly people with pain in their lower back and their buttock area. And I usually have to sort out, is the pain coming from the low back itself? Is it coming from the SI joint? Or is it coming from the hip? So I have to sort that out a lot.
Are those the main two reasons if someone's suffering from lower back pain, the SI joint or the hip?
Well, no, there's a lot of causes for low back pain, and a lot of it has to do with arthritis in the actual lumbar spine, which is just above these SI joints. And it could be pinched nerves, slipped discs, arthritis of the joints up there. And then hip pain can be caused by radiating pain from pinched nerves in the back. The SI joint itself will radiate pain into your bottom and a little bit down your leg. So it can be similar to the pain you'd get from a herniated disc or arthritis in the spine.
Now, what is that nerve that runs down
So that's the sciatic nerve.
Sciatic, right? The sciatica. So I keep hearing about sciatica. Like it's just this big, problem with most people. Every now and then, when I'll sleep wrong or whatever, I'll get up. I'll have a little bit of that, and eventually it works itself out, right?
It should, yes. Okay. Hopefully it does.
Okay.
But yeah, a lot of people come in and they say my sciatica is flared up. And they almost always grab their bottom.
Right.
And so sciatica, it really is sort of a catch-all term. And the sciatic nerve truly does come out of the spine, runs down by the SI joint, and then down into the leg. So there is a sciatic nerve. But generally the problem is not the sciatic nerve. It's the headwaters of the sciatic nerve upstream in the lumbar spine. But the SI joint, which is what I focus on, is also can cause pain that's very similar in nature. So you have to try to sort out that whole system.
You call it the SI joint. it's just hard for me to imagine a joint in this spot. Like, it's easy for me to imagine a joint on my arm or my leg because I kind of have a visual for that when I look at the skeleton. What does the SI joint look like? Is it like a hinge or a swivel or a
Well, it's
ball
kind
and
of
joint?
it's not any of those real. It's more like a joint in a table. Like if you imagine that you're going to take a table apart and put a leaf in it for Thanksgiving, and then you put those connections. So it's more like the connection joint in the middle of a table.
Okay.
Although it's not a straight joint, it has a lot of convolutions and angles to it. It's sort of boomerang shaped, and the two parts lock together, and then there's a bunch of ligaments that hold it together. And so it doesn't, you don't think of it because you don't see it moving. It moves maybe 2 or 3 degrees at most, and it's a rocking motion that happens. But it's not like a knee joint. There's not a lot of motion there. So people don't even know it's there until it flares up, and it can cause really serious pain.
Because of its shape and all the ligaments connected to it, is it a more difficult part of the body to work on as far as an orthopedic surgeon is concerned?
Absolutely. It's really hard to get to if you're going to open that joint directly. You have to really take the pelvis apart. So it's hard to get to. And so I've been excited with some of this newer technology that we can deal with it without having to take the whole thing apart.
Now, can you explain that? Because that sounds really exciting. Because the last thing you want to do when you go in for back surgery is, everybody says, back surgery. Oh, no, they're going to open them up, and it's going to be, they're going to have to spend hours in there, and then he's going to have all sorts of pain. And so are there new techniques where you don't have to do all that?
Yes. So this is the technique that we've been using since 2010 is a small incision surgery, and we use neuromonitoring, electrical testing. We use X-ray machines in the surgery so that we can get across that joint to stabilize it with very little soft tissue damage.
We have a question from a listener. This is from Katie. I'm going to ask the question. It's from Facebook.
Yeah, it's our Facebook page.
Katie asks, does glucosamine, or I hope I pronounced that right, and chondroitin, help if you have back pain? How about yoga to ease pain?
So glucosamine and chondroitin sulfate are used for more for knees and for wrists, hands, shoulders. It doesn't seem to be as effective for the spine for whatever reason. And it's not a magic combination of medicines. There's studies that say it's okay, and there's other studies that say it really doesn't do much. So
what the other part of her question is, what about yoga? I mean, obviously, we can kind of work out on other joints and make ourselves more flexible. Is this one that, because it's so difficult to move just a few degrees, is it one that's kind of hard to train?
So, yeah, this joint doesn't really respond to yoga because, again, it's a strong connecting joint. It's not a motion joint. So you don't want it to be loose. So yoga is great for the low back and for hamstrings and other parts of your body, but it doesn't really affect the SI joints. It doesn't work for the SI joint.
Okay, we're going to take a break, come right back. We have all 4 of our lines open. If you want to visit with orthopedic surgeon Dr. Michael Woods, has been doing this for a long, long time. You have a question that he can ask, he can answer. He's right here, and it's absolutely free. That's the great part. 721-1290 is our number. This is Health Talk, and we'll continue in a moment. Okay, we are back. It's Health Talk. 721-1290 is our number. We'd love to have you visit with Dr. Michael Woods, who's standing right here. We kind of visiting off the air a little bit about football. And I assumed, because, you and I love to watch football, the way these guys hit on each other and just pound each other into the dirt sometimes, that you'd be seeing a lot more football players in your practice. But you said that's not necessarily true.
Well, it seems like the back is inherently protected because these guys have these gigantic slabs of muscle protecting themselves, and so it's not that common to see major back injuries in a football scenario. It's the most common injury in that regard is called a hyperextension injury, where you can crack some of these small bones in the back, or you get a herniated disc. Example: J.J. Watt herniated his disc, and he's out. He came back, he herniated it again, and then he's out. So it seems like herniated discs in these young guys can happen, and then these little cracks in the bone called spondylolysis. But in general, the back seems to fare better than the knees.
Yeah.
You know, we worry about concussions, et cetera.
Mm.
But the SI joint doesn't really seem to be affected that much.
So, a question for you. There's this joint. People have it. Most people don't know it exists. It doesn't move very much, so they're probably not going to know it. If they have lower back pain, it could be symptomatic of a lot of different problems. So how do you know if someone is suffering from symptoms of an SI joint problem?
So that's the trick. That's what I do. It's detective work. And just so everybody knows, there's not one SI joint, there's two. There's one on each side. And so people that have an SI joint problem typically have this low back pain and hip and buttock pain. You can actually get some groin pain. You'll feel like your leg is wanting to give way, although it's not really coming out of place. It feels that way. Most common symptoms for SI joint problems are trouble with sitting, trouble sleeping, trouble going from sitting to standing, and like a long car ride.
When you say trouble sleeping or trouble going from sitting to standing, like is it pain
Pain.
keeping you up? Okay.
Pain. They'll wake up, they'll try to change positions, and then all of a sudden it hurts, and it can hurt really badly, and it's really deep inside there.
What about like the feeling like a Charlie horse down low?
Well, that's more like a muscle cramp. So this is more of a deep, aching, burning type pain that can actually radiate down even below your knee.
Okay.
Now, if people are out there, I know that there are folks out there listening right now here on Health Talk that experience back pain. So if you're experiencing back pain and you're not quite sure, if you're just kind of living with it, it's just kind of chronic and you've learned to live with it, maybe Dr. Woods could give you a little advice on some avenues to because nobody wants to live in pain, right?
That's right.
It's terrible. So,
And you were mentioning the new technology made it so you didn't have to break apart everything, right?
Yes.
So what are you going with, a robot or something? Or do you shrink down to microscopic size? I mean, with all these Marvel movies coming out, you never
That'd
know.
be
Voyage,
awesome.
yeah.
I just came back from a international meeting in Boston, and there were robots all over the place. That's coming. There's a lot of really cool stuff coming in the next 10 or 15 years. So there's only a few places doing robotic surgery. But what we're all trying to do, and this is a part of that, is they call it minimally invasive surgery. It's smaller incisions with less soft tissue damage to get where you need to go. So this technique is like that. We basically split the muscles of the buttock and go down through there. And again, we use neuromonitoring techniques and intraoperative X-ray machines called fluoroscopy to do it.
Okay, I didn't know about half of the words you just said.
Oh, sorry.
So what was the type of X-ray you're using?
So it's called a C-arm. It's basically a portable X-ray machine that we bring into the operating room, and we spin it around in various ways so that we can see bony landmarks without actually looking at them directly.
all right. So now we're getting calls. This is good. 721-1290 is our number. Dr. Michael Woods is here in studio, and he would love to visit with you about what's going on with the pain that you're experiencing. So let's get Brian on the line. So grab those headphones, Dr. Woods, if you don't mind. Okay, Brian, you're on Talkback with Dr. Michael Woods. Go ahead.
You bet. Thank you. When I was 22, which is a long time ago, I'm 65, I had the bottom 7 vertebrae in my back fused. And they told me that I was to go home and basically do nothing because by the time I was 45, I would be in a wheelchair, and there was nothing anybody could do about it. And I'm still walking, I'm still active, I spend a lot of time up and moving. But the pain is definitely intensifying from, over the years. It wasn't that I couldn't walk, they said that the pain would be too great. Have you got techniques now to help?
Absolutely, Brian. First of all, any doctor that predicts what's going to be happening in the future is making a big mistake because we don't have crystal balls. And I'm glad you're still out there getting it done.
Now, Brian, how are you dealing with that pain?
I just deal with it.
You just grin and bear it, huh?
Oh, yeah.
All right.
Well, it's interesting, Brian, because the SI joint, again, is at the bottom of the spine. And if you've had a lot of your Was it your lower or your middle spine that got fused?
It was a bottom 7 vertebrae,
Yeah, so they did.
a lower lumbar.
Right. So what happens is once you get all of that fused together, it puts a long lever arm on the next joint below your spine, which is the SI joint. So we see a lot of people that have had previous back surgeries and fusions that have continued pain or develop a new pain. And a lot of times it actually about 40, at least 40% in most studies involves the SI joint in some way. So
Along the line with the fuse question, Kitty wants to know if you could tell her about artificial joint replacement, if it has been approved by the FDA versus fusion.
Thanks for your call, Brian. Appreciate it.
So I think she's talking about a total disc replacement in this particular area. So there's no artificial joint for the SI joint. There are total disc replacements for the lower lumbar spine, and there are certain centers that have really good results with those, and other centers have not been able to reproduce their results completely. So there's still some controversy about whether a disc replacement in the lumbar spine is going to be more effective than a fusion.
Okay, we're going to take a quick break. Mike, we're going to get to your phone call. We have 3 other lines open. Dr. Michael Woods will be with us about 8 more minutes, so give us a call at 721-1290. We'll be right back. Well, this is unprecedented, ladies and gentlemen. We have our very first medical rock star here in the studio, Dr. Michael Woods. All of a sudden, all 4 lines are full and only a few minutes to get as many calls in as we can, so let's jump right in here. Mike, you're on Talkback with Dr. Woods. Real quickly, what's your question?
Hi, thank you. I was listening to a radio program earlier, and they were discussing the benefits of stem cells, and I know embryonic stem cells are kind of controversial, but do you see stem cell therapy from other sources being a factor in back help?
Okay, thanks. What do you think, Dr.?
Well, sure, Mike. We actually are using some stem cell technology when we do back fusions. We're trying to preserve stem cells. And again, I was just at this big conference in Boston where this was being discussed extensively, and there's a lot of new research into stem cell therapies that looks promising, but a lot of it is unproven yet and not FDA approved. And you got to be careful because there's a lot of guys out there trying to put stem cells in everything, and it's essentially a scam.
It's a new breakfast.
Right.
Be careful.
Well, let's get Alan on the line. Alan, what's your question, real quick?
Yes, sir. I've got a repair of arnochiaris ×2, lateral trauma to the right side, military-related, C3 through 6 replacement. Dr. Beck did that. A cyst that was removed in L4. And right now, I'm pretty sure I've got 23 years as master's degree in medical science. And right now, I'm pretty sure I've got CSF rhinorrhea. And it's getting to the point now where I'm just a little too far with it, and I need to get it repaired pretty soon. I've waited almost close to 2 years to do this denial thing. I'm thinking of going to Birmingham. My son's there in the military, and have it done there. But I also think back here at the base of the occipital, there is a place where the dura was not replaced from a surgeon from my second arnochiaris repair, and I think it's leaking there too because I get lumps of fluid, so to speak. What is your recommendation?
So, Alan, that's I'm not a neurosurgeon, and that's more of a neurosurgical thing. And I talked to Dr. Beck about it, or maybe go to a bigger place, Salt Lake City, Seattle, or Birmingham. It sounds like you got trouble there, and thanks for your service, and sorry you're having trouble.
All right, Rena, 30 seconds. What's on your mind, real quick?
Okay, good morning. For years I have been able to go to meetings and sit there in chairs and then not be able to stand up without a huge amount of pain. Is that something that this would be concerning?
Yeah, that might be symptoms of an SI joint problem.
Thanks, Rena. Okay, so... Okay, we're like 1 minute till we're done. So how do we contact you if we have questions just like Rena's? What do we do?
So we've got a website, Missoula.YouTube.com, We just made a educational video that sort of outlines a typical patient with an SI joint problem, and you can find that there. You can also find that on our Facebook page. And give us a call if you have questions.
Okay. So what's the number?
It's 721-4436.
All right, we're going to get you your Rockstar T-shirt as soon as possible.
Okay, sounds great.
Dr. Woods.
Thanks, guys.
And thanks so much for taking the time to be with us.
It was fun.
We
Thank
appreciate
you.
it. All right, Dr. Michael Woods, orthopedic surgeon with Missoula Bone and Joint, and that's going to do it for Health Talk today. Stay with us. At 9 o'clock, we'll be visiting with Rob Nadelson from the Independence Institute as the day before Election Day. So stay with us. We'll be back.